Praise the Lord. My name is Bishop Jackson Kingori of Neema Gospel Church. I'm here to invite you to join us for a great time of worship. This is a place you don't want to miss. Every Sunday is exciting for you and your families. Your children will have a wonderful program that they will never want to miss church again. Your faith will be strengthened. You will not be judged because of who you are or where you come from. We practice the grace of God. And we are located at Royal Town along Githuguri Road, not far away from town, in a place called Imani Gardens. Please join us and come and have an experience like none other. God bless you. Looking forward.
Elevate TV, advancing kingdom lifestyle.
Welcome. This is your Friday GG report. Welcome you to the show tonight, wherever you're tuned in from. My name is Godfrey Gichuki. I'm your host for today. And wherever you're watching from, please remember to share. We are live on our social media platforms. That is Elevate TV Kenya Facebook page and Elevate TV Kenya YouTube channel. Please share and welcome to an exciting episode of the GG Report. I have a very special guest with me. All my guests are special as always, and today you are going to enjoy this conversation. I believe you're going to learn a lot, and yeah. So one more time, the GG Report is a platform for big, bold, and honest conversation, deep conversations. So we're going to dive into a very interesting subject. That is the subject of health care for mobile populations. We are using that term actually to refer to health care targeted at truck drivers, long distance truck drivers, people always on the road, and as you know, there is a history around people who use, especially the truckers that travel, say do trucking all the way from Zambia, Dar es Salaam, Mombasa, Nairobi, all the way to the other side of Rwanda, Congo. You know, if you're on a big truck and traveling across that whole corridor, it's quite complicated, and these people actually do need some help and healthcare. They are always mobile, and there is a big story around that. And today I'm joined on the show by no other than Eva Mwai. She's the director of North Star Alliance. This is a development organization that healthcare and development organization that actually has created a niche providing health care, and especially dealing with diseases that are associated with people who are always mobile. And I'm sure you're going to hear a lot of insights, and please remember to comment, ask questions, and I believe you're going to enjoy this conversation. So Eva Mwai, madam, welcome to the show. Please look at this camera and introduce yourself and welcome our audience to this conversation.
Thank you very much, Pastor Gigi. I'm grateful. Thank you for having me. My name is Eva Mwai, as you've said, and I'm the director for North Star Alliance. I started my journey in development work when I was a young girl, years back in the late 80s after my studies, and since then I have worked for various non-governmental organizations. That has been my field all the time, and until now where I am. I believe not very far from retirement.
Okay, wonderful, wonderful. So, remember to, invite some of your colleagues that you work with, tell them to join the conversation. I hope Ann Rita is watching, one of the persons that actually connected me with you, and of course your team in the office. Tell them to, make sure they share the links and join us in this conversation. All right, so let's dive into this conversation. Of course, the big question is, how do you provide health care for mobile population, people who are actually always on the move? And then that's one issue. The other issue is the issue of that mobile population, or people who are always on the move, truckers and people who are in the transport corridors, tend to actually also be associated with transmission of diseases. And today we are also going to also ask about our guest to talk about Mpox, and of course the story of HIV and how it was transmitted for a long time by truck drivers and people who are always associated with those kind of people who are always mobile and moving. So it's a very big story. So Eva, I really, one of the reasons why I really thought that I wanted to talk to you when I was introduced to your organization is there are stories associated with this particular sector, what you call the transport corridor, and the populations that are associated with that, people who actually work in that particular sector. So tell us about North Star Alliance and the genesis of it, the story behind this, and then maybe some of the some of the issues you've been dealing with throughout. I know we will dive right into the conversation, but let's have a place to begin this conversation about how did North Star Alliance start?
Thank you. I think that's a good place to start. North Star Alliance was formed way back in 2006 in Malawi. Okay. By two organizations, and that's why many times we are referred to as a public-private organization. Okay. TNT Logistics Company, Transport Logistics Company, and the UN World Food Program. Okay. And the reason was when the two organizations were involved in some exercise transporting food to drought-stricken places in the Southern Africa region, and they realized that the number of truck drivers was becoming, less and less, and so the journey started now asking why are we getting a reduction in the number of truckers? And after an assessment with the Ministry of Health in Malawi. And I must say that this assessment, it started earlier, before 2006, before the formation of the organization. So it was a period when they started noticing the difference in the numbers. And of course, that brings a worry to everyone. What will happen to the supply chain if we have no one transporting goods from one place to the other? Right. So there comes North Star Alliance. Okay. So after consultations, they came up with the concept of converting sea containers. Because sea containers they resonate very well with what the truck drivers do. Yes. They always move them along. There's always a container behind a truck. Precisely. And traveling for a long distance. Yes. So they resonate very well with what they do every day. And then they are cheap to convert, and they can easily be moved from one location to the other. Okay. Because sometimes a truck park can change. So North Star was born there. One clinic to provide, and the assessment, of course, showed that the problems that the drivers were encountering, diseases, like HIV and sexually transmitted infections, of course, tuberculosis and all those other diseases. Of course, they are not the carriers, and I want to make this very clear. They get the disease, but they are, they get it from people also. And of course, when they go to the various places they pass through, then it's possible that infectious diseases will spread.
Yes.
Anyone who is
infectious
moving.
diseases by their nature. If there is somebody who is actually moving, they are involved, they are moving from country to country. Infectious diseases tend to spread that way. Yeah,
correct.
That's
Perfect.
definitely
yes.
a fact. Yeah.
So there we started with one container, and the concept was, taken very positively by the drivers themselves and the stakeholders. And so we started replicating that to different other places in South Africa and other countries in Southern Africa. We actually have covered many countries in South Africa. There's Eswatini, Botswana, Zimbabwe, Mozambique, Malawi, Zambia, and South Africa itself, and Lesotho. So after 2 years,
let me interrupt you, because there is something I want our viewers not to miss.
Okay.
We'll come back to the expansion.
Okay.
I think when HIV was at the peak in Africa, some of the countries that were very seriously affected was actually Zambia in particular was seriously affected. Uganda was.
Yes.
Zambia and South Africa. HIV was a very, very devastating disease, and I think that is something, Madam Eva, you probably can just unpack a little bit, so people need to understand exactly the context. How comes that this organization, it was a private organization, it is a private organization, TNT. It's an international like DHL.
Yes, you're right.
And these guys have very large business. Especially transporting maybe even copper and mining products in the southern region. And these guys start running out of drivers. So I think it's important for you to lay that out. Yeah.
Yes. I was actually coming to that. So many of the products that we use on a day-to-day basis, including medication, the very essential things that we use, they are transported by road.
Yeah.
The food we eat, the clothing, everything. So you can imagine if the transport corridors being, the conduits of trade and economic development, because of course when goods travel from one place to the other and people are trading and all that, then the economy of the nation will grow. So if you can imagine, if a company is producing, some material in a place like Mombasa, and that is supposed to be used by some landlocked countries, so somebody needs to transport that.
Yeah, yes, exactly.
It's not always possible to transport by air. It's expensive, and so the road will be very, very essential. So the transport corridors, and that's something that many people do not understand. They are very useful channels for many, many things, many good things for the country. Trade, economic development,
communication in
communication,
general. Yes.
Promoting health also. But on the other hand, if something is not done to ensure that the transport corridors are operating effectively, then of course there will be problems. And so there is one person who is very key in the whole of this circle of things, and that's the truck driver.
Okay.
Yes, so that's what I would say. That is why a private company like TNT would recognize the importance of ensuring that the transport chain is effectively taken care of.
Okay.
And it's healthy and safe for everybody living along, moving along. Yes.
Wonderful. So let's come back to the expansion.
Okay.
I interrupted you when you were talking about how North Star Alliance,
Yes.
2006, and this coalition of partners, the private operators, and this organization was formed. And basically the idea was to kind of provide a solution, a health care solution for mobile. guys along the transport corridors.
Yeah.
So you said Eswati. I don't know
Eswatini.
how to. Eswatini.
That was Swaziland.
Eswatini. Oh yeah, Swaziland converted to Eswati. They decided to change their name, right? Yeah. And South Africa, Zambia, Malawi. Maybe are you also in Angola? Mozambique?
We have Mozambique, yes.
Okay. So then tell us about the rest of the expansion. How did you get to East Africa?
Oh,
and
yes.
Where else are you?
So after 2 years, the people who were behind this force decided to try East Africa because, of course, it was performing well and many lives were saved. So why not do it, in many other areas in the sub-Saharan Africa. So that's how we scaled up into East Africa. And East Africa scoping started in 2008 mid. And then that's how now I got into this organization. I was working elsewhere before, and I did quite a lengthy interview for many months, but I joined them right at the beginning of 2009. So that's when North Star East Africa started now, doing operations in Kenya, Tanzania, Uganda. We went to DRC, Eastern, and near Kinshasa somewhere. And then we also did something in Burundi. So yes, so we did that expansion. And maybe I can say what we do with those containers.
Yeah. So just tell us how do you provide this health care?
Yeah, so initially the focus was so much on HIV because it affected the entire Africa. Sub-Saharan Africa, of course, was impacted quite negatively. So we started by educating the drivers, and we don't just see the truckers themselves. We also are careful to open our doors to everyone all the community members who live around, who interact with this truck driver, because they are traders, they are women, men traders, they are young people, they are people who run businesses of all kinds. And there are also, many women, so we open the doors to, for everyone.
Okay.
And so HIV prevention was our first entry, and sexually transmitted diseases, screening and providing treatment.
Okay.
Now, North Star does not do this alone.
Okay.
The Ministry of Health is very instrumental, because remember, an organization like ours is very tiny compared to the whole health system of a country, and we have to follow their guidelines and do whatever they ask us to do, because we are just complementing in a little way. So they provide the commodities like the testing kit for HIV, and in some cases even some antibiotics because of the sexually transmitted infections. So we started with that, but very quickly we realized that because the driver may not be able to access healthcare very easily, when they are concentrating on just moving along the highways, and there might not be health facilities where they are. So we found it very necessary to broaden the service package, the offerings, and we did other primary health care, yes, like if you have a headache, of course, you can get care. If you have abdominal problems, if you have any other, disease, malaria and all that, because you can imagine you have a whole big truck with 2 containers behind you.
Right.
And you're supposed to take care of the goods and to protect them. How would you veer off the road to go 1 kilometer away to seek medication?
Okay.
Apart from now, you go to the chemist and you haven't been diagnosed properly. So we place the containers very strategically where the trucks park, and where there are the transit hubs and at the border points.
Okay.
That's where you find very many, trucks parking. And so we offer more than just HIV testing. We broadened also to include provision of ARVs.
Okay, okay.
Yes. So you come to the clinic, you're screened for TB, you have diabetes, at least we are able to provide you with some medication. And I must say sometimes this is not always possible because of lack of resources, adequate resources.
Yes.
But the ministry has been very instrumental because we get what we can from them. Diseases like malaria, we get medicine for malaria, for TB, ARVs we get from, the county government, say in Kenya, in the other district health, management systems in the other countries. So that's what we do. In the container is a clinical officer.
Okay.
In the Southern African region, we have senior nurses because
Okay.
there are no, in some countries, there are no clinical officers, that cadre.
Okay.
Then, so we have senior nurses, we have clinical officers, then we have a HIV testing provider, services provider, we have field workers.
Yes.
We have someone who takes care of data. And I mentioned data because that's very critical to North Star. I'll mention why. And then we also have, peer educators in
Yes.
the community. Because you realize that some of the people we deal with, like the female sex workers, if you don't get their counterparts, their peers, to take the education to them, then it will, maybe they might not relate with the likes of all of us, They will listen to their own better, even the trackers. We also have ambassadors who take care of the health needs of the trackers, passing information to them and all that. So the reason why we have data people along the corridors, when North Star started, we realized that we deal with people who move.
Okay, okay, okay.
When they are moving, you come from Congo. Our clinic in Congo, we closed it temporarily. It's called Bukavu.
Okay.
Bukavu, you come from Bukavu, then you come to Uganda,
Right.
the border of Uganda, or you pass through Rwanda. And then you are treated in one clinic. By the time you get to the other clinic, if there's no information about the treatment you're given, you might have a totally different, diagnosis and treatment,
Okay.
system.
Yeah. I'm being tempted to to interrupt.
Okay.
As you follow this conversation, we are talking about providing health care for mobile population. We're talking about truck drivers. And my guest here, Eva Mwai, she's the director of North Star Alliance. This is an organization that actually provides health care to people that are always moving, truck drivers in particular, and other people that are part of that transport corridor within East Africa, Southern Africa, many countries. And her organization really has specialized in helping people and actually helping support healthcare across different countries and preventing some of the very, very serious diseases that we are all familiar with, HIV and AIDS, including Mpox. She's going to be talking about Mpox and of course sexually transmitted diseases, working with some of these sex workers. These are very, very sensitive areas, and your organization has done an amazing job. Yeah. So you are actually, just before I interrupted you, you were talking about a case of a truck driver is coming from Bukavu and goes through Rwanda, comes to Uganda, maybe let's say even just like they have a condition like TB or maybe a malaria, they are battling some malaria infection. And so every time if they stop in one of the clinics, if there is no information, then they may have to be told, no, look, we have to take your blood samples afresh. We have to establish whether what you're telling us true. These papers you've written, we don't even the language barriers, stuff like that. So you're saying that actually can be a very, very complex system where you're taking care of people that are moving. Yeah, so tell us more about
I
that.
think, Gigi, you should join Northstar. It appears you're getting it right.
Yes.
The reason, so when we realize the importance of, capturing data properly, and for people who are very mobile, we did develop an electronic record management system, medical system, sorry.
Okay.
And it's called Corridor Medical Transfer Transfer System, COMETS. COMETS ensures that once your data is captured in one end of that corridor, it is transported in real time to all the other clinics, wherever you go.
Yes.
So if you had malaria in one area,
in Zambia,
yes, and you traveled from Zambia, you go to Malawi or Zimbabwe.
Yeah.
Say you land in South Africa.
Yeah.
And your condition has not improved.
Okay.
And the clinician would like to know what treatment you are given. Then you'll find it on this, in the system right from. It has already gone.
Okay.
Real time.
Yeah.
So that's one thing that's very unique, to the Northstar Alliance. I must say that because of time lapsing and us seeing so many people, we are upgrading that system right now. But so that's why we have data and we take care of our records very, very seriously.
Okay.
So there are those people now working in that clinic. That's how our setup is.
I love that. I love that actually. Providing medical care across different countries, same organization across different countries, okay, does provide quite a bit of challenges. Tell us about, for example, now, I mean, if you are running a clinic in Malawi, and the same clinic in Zambia, and then you're in Kenya, you are in DRC, and you know all these things about visas and papers.
Yeah.
How do you deal with all these governments and jurisdictions? How does it work? How do you ensure that Northstar Alliance is able to operate in all those countries?
We are very much supported by government agencies, and to bring the story closer home, where we know the centers in Mahim, Lolongo, Salga.
Yeah.
When we set up first, we have to meet the government authorities. Of course, you have to register, you have to be given authority to work in a certain country. Then you need to know whom you're going to engage with in the different local areas where we work. In Kenya, for instance, we set up our clinics on road reserves. And you can't do that without KENHA.
Okay.
So KENHA has authorized us to do that, and then so they are our very good partner, and we give them reports on what happens, every other time. So, and we have to seek authority to be there every year, documented.
All right.
So that's very good government support. And then, of course, the Ministry of Health, they have a way of dealing with non-governmental organizations, ensuring that, and civil society organizations, to ensure that they operate in a well-organized manner, coordination.
Yes.
For HIV, we have NSDCC, the former NAC, National AIDS Control Council. Now they have changed the name to National Syndemic Disease Control something.
Okay.
And they are now, all of us work under them, and we listen to what, we are guided by what the principles and the policies that they make. Then there is the National AIDS and STI Control Program, NASCOP.
Okay, okay. We're going to go to a short break. Madam Eva here and telling us about her organization, Northstar Alliance, that provides healthcare services for mobile populations, people that operate on transport corridors, operating in different countries, in Africa, Southern African countries, and East Africa, and in Kenya in particular. So if you're in that sector, or you probably you get sick on the road, I'm going to be asking her whether it is okay for you to pop in one of their clinics, and we'll be telling you more details about that. So, but for now, we take a short break. When we come back, we'll come back to this conversation. So keep it elevated, don't go away, take a coffee, and then come back to this conversation. All right.
Looking to build passive income? Imagine owning a property that generates income while you passively sleep. Naivera specializes in empowering investors like you to achieve just that through investment in affordable rental apartments. Join the ranks of smart investors who are building wealth through income-generating assets, that is affordable rental apartments. The good news is that you can manage your investment hassle free on your mobile phone. We are currently selling Membley Heights. The apartment has ample parking, high-speed lift, 24/7 security, and spacious units with high-quality finishes. With just 1.89 million, you can secure this investment, which offers a return on investment upwards of 10% annually. Usiachwe nyuma. Take action now and start your journey towards wealth creation. Talk to us today on 0798 999 000 or 0115 169451.
Welcome back. This is the Gigi Report. We are talking about healthcare, providing healthcare for mobile population. The whole idea of people that are in the transport logistic systems, and people who are actually always mobile in the in the transport corridors of the region. There is always we're talking about truck drivers. Basically, wherever you see a big truck on the road, on the highway, somebody traveling all the way from Zambia, Harare to DRC Congo, through Uganda and Rwanda, maybe delivering some specialized materials. These guys actually do need some health care, and North Star Alliance is an organization that actually does exactly that. They provide health care for this kind of population, and they deal with some of the diseases that perhaps sometimes not many people actually really care so much, to think about the details. So let's go back to the conversation. Madam Eva, I want us to talk about the diseases themselves. Your organization is doing a fantastic job. You provide the facilities, the clinics, and people need to know that you are on the northern corridor, all the way from Mombasa to the border, Isebania and Malaba. You have actually clinics all the way, including Saga, of course, Naivasha, I guess, and other places. You tell us about that. But let's talk about the disease. Earlier on, we were talking about HIV and AIDS. How when HIV and AIDS at the peak of the prevalence of this disease, Africa was seriously devastated. Some of the countries, Zambia, South Africa, Uganda, and even Kenya, a lot of young people, a lot of people in their prime were lost their battles with HIV and AIDS before we got into, before we had the ERVs and all those other programming coming in. And there was a lot of concern. The West had been able to deal with the disease early alone, and their medical systems are very advanced. But here, this is Africa. So tell us where we are on HIV and AIDS, because it is possible for people to lose that conversation. And just keep quiet about it. But HIV and AIDS is still a reality. So tell us about that, and then after that we'll go to talk about Mpox. All right, but let's start with HIV.
Thank you so much. HIV is still real, and it's still among us. Right now, I think there are about 1.6 people living with HIV. 1.6 million. Yeah, okay. Sorry, 1.6 million people.
Okay.
And what happens is that HIV affects, categories of people, some populations of people.
Yes.
This, the pattern right now. You might find there's a time we are talking about even the general community, but there's a category of the population that's referred to as key populations. Key populations, you find maybe the gay men, there are also the female sex workers and such categories of people. There's a time that, or rather, they are more at risk because of their sexual activity. Then you also find that the young people, especially today, we are very worried about the young people, youth. Yes.
As early as 15 to 25.
Even below, unfortunately, even below.
All right.
There's a lot of activity that is going on, and a lot of infections that are, coming up now from that population. And the government is trying to do the best that it can, and together with the partners, a lot of donor funding will go into programs that ensure that people are tested. They are linked to care immediately, because now once you are HIV positive and your test is positive, then you immediately can start getting medication. Then ensuring that you adhere to the medication and you're virally suppressed.
Okay.
There's no, it cannot be detected.
The viral, because most of the medication, exactly. I think, some of our viewers are not technical, but I like that particular, concept of viral suppression, which is actually what most of the medication for HIV and AIDS actually does. It suppresses the viral load in the system. It doesn't
cure the virus. It just suppresses. And as much as when you're suppressed, when your immune system is suppressed, you may not infect your partner. But it's good to be cautious, to be very cautious, because of course, if you're not taking medication properly, infection can easily be transmitted.
Okay.
So there's the concern around the youth, there's the concern around the key populations, and we were getting a lot of the trackers also moving from one place to the other. And mobility of people, especially coming from areas where the disease, the epidemic is heavy. Management of HIV is now very, very effectively done. If you adhere to your medication, you can live a healthy life. But I would want to caution people that they need to be careful about behavior and avoid interaction and sexual activity, especially now for the youth. Why should they go, about, these activities when they are at that age, they need to be responsible and wait.
Okay,
Yes.
okay. So basically, HIV and AIDS, what you're saying is that it's still a big problem, and that's one of the elements in your programming, you know, because you target this particular key population, mobile people, truckers, and people associated with that, and that's wonderful. Now let's talk about the new phenomenon, the Mpox.
Yes.
What is Mpox? And
HIV is now among some specialist groups, so
Okay.
it's not as it
Prevalent.
was before, as
Okay.
prevalent as it was before.
Okay.
But now coming to Mpox, and talk about Mpox, and there was also COVID.
Yes.
Those are diseases that are very easily transmitted along the highways, and I think the first case was a truck driver. And this is a disease that is more among, it's actually an animal disease whereby it's transmitted among the animals, but in the 1970s, I think the disease, and the first was in Congo, where
It's crossed over to
humans,
Yes.
to human beings. And so now that it is now moving, and it's quite a lot, it's, there's a lot of very many people who are infected in Congo. It is important that for us to know that people can actually bring it along the corridors to other countries, and that is happening because in Kenya we have five cases already, and we are being warned about taking care of our hygiene, maybe hand washing, and ensuring that you're not sharing objects.
By the way, as you talk about the how to take care of the disease, I think what a lot of people don't know is, okay, looking at Mpox, comparing it to HIV, is it first of all, is it curable? That's number one. Number two, what sort of disease is it? I mean, what does it affect, and how is it transmitted? Is it like a viral, like the HIV, the virus, something hypo? I even forgot what H is, but I know it's the other one is infectious viral or something like that.
Yes,
anyway,
yes.
Mpox. A lot of people actually don't have a clue what Mpox is.
Sure, it's a viral disease, and I must say that I'm not a doctor. I'm only, I only deal in the, I'm in the public health space, and I've been for very many years. But I'm not a clinician. I'm not a doctor. So I can only say, some things on the surface. It's a viral disease. So viral diseases usually, virus, there's no medicine for virus. And it usually will be transmitted from human, from animals, maybe the monkeys. Now we don't call it monkeypox, it's Mpox. And you get symptoms, the rashes that you see, in the pictures that are going around. But listening to the medics, it is a disease that can also present. You may not have all the rashes to know that somebody has it, and it can be cured. No, you don't cure it. You manage the symptoms. Like now the rashes, ensuring that the way the clinicians manage them. If it's fever, managing the fever, but it's curable. People get cured, but there are complications that can also cause death. For instance, in the Congo, we have heard that people have died, and in Kenya, 2 cases are cured. So yes, it can be cured. But as much as it can be cured, I think it's good to be cautious and take the measures that are necessary.
And why it is a big deal is because it is an infectious disease.
Yes.
And it's easy to transmit. Maybe how do you? So if someone had Mpox and they came to the workspace, for example, a colleague picked up some Mpox. One of the drivers also happens to work for some big organization. He picked up the thing in Congo. Now he is in the office. Does it just jump if you sit with the person? How does it transmit?
Again, not a medic. I'm not a medic.
Yes,
but you can be infected through the bodily fluids.
Okay.
Sexual activity is one that through which you can get infected, and also through the body fluids, like even saliva. Touching where there's the rashes, and objects of like touching things that have been in contact with the people who are infected have come into contact with.
Okay.
So those are the basic things that I can say about Mpox.
Okay.
Yeah. So it is highly infectious, and bodily fluids, kissing, such things you can contract.
Okay. Wonderful. I hope now we've laid it clear that Mpox actually is actually monkeypox. It's an infectious disease.
It's no longer monkeypox.
It's we don't
Mpox.
want to use the word,
Yes.
monkey there, but it is. It's
Mpox.
It's Mpox. It's an infectious disease, just like COVID was, and HIV, and it falls in that. Is there, because you are in that space, I'm sure you've been in forums where experts have spoken about this particular disease. What exactly are the fears in terms of in the medical health? Do they feel like if it is not taken care of, it can spread just like COVID, and then you have whole populations infected or something like that?
Yes, because it's a highly infectious disease. It can spread.
Okay.
It can spread rapidly, but the measures that should be taken is ensuring a lot of surveillance, especially at the border crossings where people are moving from one place to the other, ensuring screening, and I think that, and a lot of awareness creation about what kind of disease it is. And as you say, that people have not quite become aware about it. We need to disseminate information as much as we can. And not being in government, I know I can say that I've seen the government doing a lot, trying to educate and taking care of the cases that have already been identified.
Okay.
But it's good to mention that I think surveillance, continued strengthening surveillance is very, very important, and ensuring at every entry point into the country, people are being screened properly. And, sometimes it also, there's also vaccine. I don't think it has come to Kenya. But what I say is that the government is aware, the Ministry of Health, of course, is assessing the situation and the seriousness of the disease at the moment, and I'm sure at the appropriate time then they would take the measures that they should take to ensure if it's spread so much. But right now, 5 cases in Kenya, and 2, isolation is being done, contact tracing, which is very important, is being done, and the people being screened. So something is happening, but more can happen.
Okay. And in fact, maybe I will take you back on the issue of during COVID. COVID actually, and you tell me what you think about this. COVID actually did shift a lot of things in the medical health or medical care systems, because things like isolations, things like those are things that were completely new. Now, there are not things in the public domain. In the medical health, domain, people know what is isolation. They do isolations in hospitals, and so. Do you think that countries are probably much better prepared for an epidemic sort of disease, given the experience we had with COVID?
I must say so. I must say so that there's a big difference with what is happening now. The preparedness within the ministry, and especially also, organizations that deal with the health services, healthcare in different places. What I have seen is that we are much better off than before COVID.
Okay.
Yeah, because people learn from experiences and from lessons that we learn every day.
Okay, wonderful. Now, now that you're in the public health space, I have a friend who is actually studying public health at a very advanced level right now. There are people out there who young people, you know, who are pursuing careers and they are interested in public health. Public health itself is not very, it's not very clear. Most people know nursing, they know working in hospitals and all those very obvious places. Are there what are the opportunities in the public health? What are the challenges of working in the public health spaces? Now that you've been in that sector for a long time, do you struggle to find people to hire, for example, and place them in those containers you're talking about and stuff like that?
Well, people have gone to school. We don't get problems. There are many young people who are not employed, and they have done clinical medicine, they have done nursing, so they are still out there. I've seen you've also seen the doctors complaining that their own have not been absorbed in the system. So I wouldn't say that you know, personnel, the health resource for health, you know, the human resource for health is a major problem. And in Kenya we have very highly qualified medical personnel, you know, at the different levels. And so what I would say is maybe a major problem is the facilities, the commodities, the equipment sometimes that you may require. For instance, let me talk about what I know and what I see. As North Star Alliance, we may not get enough medicine, you know, to dispense in our clinics because you need resources, you need money. And equipment, you know, such things. The other thing is maybe very good, very effective data management systems, which I have seen a lot of improvement now. Then there's also one of the problems that I find along the corridors especially is, and I think it's everywhere, it's people using a lot of off-the-counter medication, just going to the chemist and getting whatever medicine they want to get before proper diagnosis. And right now there's a lot of problems with antibiotics because people will go get antibiotics.
Self-prescriptions.
Self-prescriptions, and then you find that there's a lot of resistance. That is a problem. So the health-seeking behavior, it is a big problem. People need to be told that right from the early stages, seek good medical care, you know, medical care. And in primary health care, preventive health is very important. Because if people kept good hygiene, ate well, you know, good nutrition, and took care of themselves. And that's what now the community health promoters are doing. They are the ones that have been, you know, taken to various places by the government. When we have community health workers or community health promoters who are capable and they are knowledgeable to educate people about how to prevent themselves from various diseases, then the disease burden will of course be less. And you don't need a lot of curative care. So if we can deal with prevention, that would be very good. And we emphasize on educating people on ways of preventing diseases even in our places where we operate, at our clinics and in the communities where we work.
Wonderful, wonderful. Very, very valuable information, very, very valuable insights here. Those of you that are following this conversation, I believe that you are learning, and this is a very important conversation because we need to understand it's not just so much providing the actual, you know, technical care, but also going beyond just providing the medicine, but also thinking about behavior. And you mentioned actually this whole business of, for example, that different, you know, people kind of wanting to take shortcut. When you get ill, when you get sick, obviously you want to get rid of the pain as quickly as you can.
Yes.
And so if your favorite chemist guy, you can even call them these days. You tell them what you think it is. And
I do as well.
Yeah, they disperse something, to keep you healthy and to cure the pain or whatever it is. So you're saying that there is a very big challenge of, for example, people actually reaching out for actual medicine before they have gone through proper screening. So yes. You're screening you are actually treating yourself of a condition that you actually don't fully understand.
Yes, many times this is happening, and in the space where I work, we have seen a lot of that happening, and it would be good that people are screened properly and diagnosed so that they get the correct treatment.
Okay. Okay. Tell me about, given your experience, how does health care compare across countries in our region? Kenyans usually, they always beat themselves very hard. Kenyans sometimes they criticize themselves. They actually think we have the worst country, the worst health system, in the world, and the worst government, of course. I dare even say anything else. Because you work in all these spaces across the whole region, you are in the best position to tell Kenyans how we actually compare in terms of our healthcare system.
Our contribution is not very big. And again, I'm not a medical practitioner, but this is what I can say.
Yes.
And I don't want to compare and say this country is better than the other. But I want to confidently say that Kenya, we are very well positioned.
Okay.
And that is why you'll find someone coming from another country to seek medication in Kenya.
Okay.
In my experience now, having worked in different countries, I know that not in the West, but in Africa and in East Africa especially, I know we are very well positioned in Kenya. Of course, South Africa is quite advanced up there, but Kenya is doing well.
Wonderful.
You can take my word for that. So let us not beat ourselves so much. Yes.
Okay. Yeah. No. I think that needs to be said, and it needs to be said that yes, we are blessed. I mean, this country, I think there is a lot of investment in the medical care, and most of the medical care that anyone would need is actually available locally. Of course, you did mention that, for example, your organization does not have capacity to provide medical care as much as you would like, and you operate actually from containers. Is that a limitation? Would you say that operating on small containers and being located along the transport corridor is a limitation? And would you like to set up a a level 5 hospital or something like that?
Level 5 hospitals, Bwana Gigi, they are available. Yes. Level 3, level 4, and that is why we need to understand in which space we are operating. Okay. Because you can't do everything. Okay. So we do the little that we can, knowing that there's a public health facility not far from us. Okay. And we can easily refer any case that needs specialized care. Okay. And that's why we work very closely with government. And the space where of course, there are some clinics that are overwhelmed. If I may mention Mulolongo. Mulolongo, right from 2010, through the ministry, we got mother and child services integrated within the container. All right. So that one is a bigger container than any other that we have. And at the moment, listening to our doctors, the MOH people that we work with, that clinic is already seeing a lot of people, and we are wondering, shouldn't we expand it? Okay. And the government has actually come in, the county government of Machakos through Athi River sub-county, 5 nurses there and personnel seconded and providing a lot of resources in there. And that clinic will see about 100 people per day or
Wow.
more.
Wow. Wow.
So when it gets there, then you know you need to expand.
Okay.
But for the others, we collaborate very well with the others that that are available, and we are able to manage.
Wonderful.
We'll always ask for more space if we can, but at least we know where and how, where we need the help.
Wow. Can you imagine? We are out of time.
Wow, you can't be out of time before I tell you something important.
Yes.
Because of the problems that we are seeing with diseases traveling along the corridor so much, COVID, Mpox now, and others, Ebola, we have recognized as an organization that we need to really work more closely. We work with people, with partners, other stakeholders quite closely, but we have recognized the need of bringing together stakeholders in a conference that we are calling Regional Conference on Transport Corridors and Health, to look at strategies that can make health, the transport chain more effective for trade and economy, and also health promotion, and how we can, learn from others and also bring lessons and best practices from others. So from the 2nd to the 4th of December this year, we are organizing a conference and bringing the transport industry actors, health professionals, the academia, people like yourselves, who are in the media. We come together, and the communities themselves, and even the target populations, come together, look at this problem, and tell people that transport corridors are very important channels, avenues of transportation and trade. So we need to put our heads together, work together, bring our synergies together, and improve the supply chain.
Wonderful. Wonderful. We got to stop there. Thank you so very much, Madam Eva Mwai, an amazing resource person. You have been in the industry for a long time, very well versed in the public health sector, and you're doing an amazing job. So, ladies and gentlemen, we got to end this here, but you've heard about the upcoming conference in December. The details will be available. You can go to North Star Alliance. Just look for that on the Google, and you'll be able to find the organization and be part of the solution. And perhaps if you are interested in that particular sector, you can contact North Star Alliance, and you'll get more information. God bless you so much, and thank you for listening. Thank you for paying attention. I believe you have learned something today, and I believe you'll be better. If you're involved in that economic sector, please seek for more help and more information, and may the Lord bless you. Thank you so much, Eva Mwai, for coming to the show. I look forward to seeing you again. I look forward to hosting you here, and we can talk more about the healthcare provision for the people operating in the transport corridors. Very important. God bless you so much. That's all we had for you today. This is Godfrey Gichuki. I'm your host for the Gigi Report. We'll see you another day. Keep it elevate, and make sure you follow our channels and subscribe. And God bless you. Have a great evening. Have a great week. Have a great weekend. God bless you. Bye for now.